Residents of Dokuma, a community in Biwari Area Council of the Federal Capital Territory (FCT) Abuja, neglected by the Nigerian government, have been trapped in a cycle of hardship and denied social amenities, relying solely on a contaminated stream for their daily water needs. The stream, used by both humans and animals, is the only available water source for the community. A visit to the community revealed that despite being visibly polluted and unsafe for human consumption, families in Dokuma have no alternative but to drink from it, cook with it, bathe in it, and wash their clothes in it. The health consequences have been devastating, including outbreaks of typhoid, diarrhea, and cholera, which have become commonplace. Residents of Dokuma have long been thrown into lamentation over the deplorable state of their only primary health center. The health center has remained abandoned by the Nigerian government since construction in 2019. A visit to the healthcare facility revealed that the grim reality as the facility has no healthcare staff, no medical supplies, no access road to the facility, and no source of power supply. Despite being completed by the Community and Social Development Project (CSDP) 6 years ago, the facility is a hollow shell with no electricity, no water, no medical equipment, and no essential drugs. Designed to serve as a critical hub for health services, the center has never opened its doors to the community. Community members recounted how they have written several appeals to the government authorities since 2019, all without response. The residents, out of helplessness, appointed a local youth to oversee the center without official support, despite its lack of formal medical training.
How do you get drugs?
So, though is since they started the project, is a non-governmental organization, which is CSDP. They are the one that come here and install this project. Since then, after the project, so they get some instrument they bring from the owner of the project, the person that they handled the project to me. So after the project, then he after they finish the project, he left the place, no anybody to be taking care or to take care of the place. So since then, the community asked me to, if I have a little way I can assist the community. So that is when I started looking for money.
How many staff do you people have here?
We don't, because we don't have, it's only me that I'm taking care of the place. We don't have staff.
Okay, like this medicine, is it provided by government?
It's the personal by me.
How do you do when there is issue of emergency now, or there is some kind of critical issue?
So sometimes I look for money and like unnecessary thing that I know maybe emergencies may come up at any time, like drugs. I will get them and keep them safely. In case in the night, in the case of labor or any they rush someone here in the night, they will come and call me because I'm near
I
here.
see there is no source of light here. Not like so, like medicine that, like, let me say, they are living drugs. How do you do to save them here?
So there are some drugs like insulin, though I do always keep insulin here for diabetes patient. So I will look for a cold place and septic box. I will keep them inside. Yes.
That is good. So now what I want to understand here is how many years have this hospital been like this?
Since 2019,
2019.
they complete this project. No any, we went to government, they write to government, no any attend, no any improvement.
Now, how do you fund water disease, or let me say waterborne disease? Is it frequent here? Or
Yes, especially typhoid, because typhoid is a waterborne disease. In some case, we do always have a patient that always come have those conditions because it's a rampart. We are having issue of water here. We don't have sanitary water, so sometimes most of the case I handle here is typhoid because lack of good water.
now the issue of this road, yes, how is it accessible to you?
Though we are facing so many challenges in terms of maybe when we have a patient that we couldn't handle, we will refer them. Instead for us to refer to Bari, we'll just refer them nearby here, Kaduna, because of lack of road. We don't have good road. Instead of me to have a patient here that maybe I will refer the patient to Bari, it's better for me to refer him to Kaduna State here
Why?
nearby because lack of road. How will you take a pregnant woman from here? Maybe she couldn't deliver, and
Like how many hours journey to Bari?
from here it will take you like 2 to 3 hour journey.
In a similar situation, a visit to the LEA primary school in the same community revealed not just infrastructural decay, but a heartbreaking story of forgotten children. The roofs are falling apart, and when the sun blazes, there is no ceiling to shield them. When it rains, the classroom becomes a puddle. There are no chairs or desks, hence many of these children, some as young as 5 years, carrying their chairs and tables from home on their heads just to have a place to sit. Unfortunately, despite the billions allocated to education over the past few years, children in Dokuma are learning in conditions that deny their dignity and crush their potential.